Cataract surgery risks and benefits. Cataract's a yellowing of the natural lens in the eye, or really any way that it's not clear that causes blurry vision and keeps you from doing the things you want to do. You have several different options, so we're going to talk about the main ways we do it here at the Eye Clinic of Florida. With us, you have a 99% chance of seeing better. You have a 1% chance of being the same. They're more likely to be in that group that doesn't get improvement if you have uncontrolled diabetes, you're a smoker, or you have untreated macular degeneration. Your chance of being worse if you had all the bad things together are less than 1 in 1,000. There are a couple of ways that we improve outcomes and save costs. Most places write for prescriptions for 3 different drops that you take 4 times a day. The local competitor uses about 300 drops after the eye surgery. Here, we only use 1. We use 1 drop for once a day for about 10 days. And doing that gives you less dry eye and puts more money in the patient's pocket, but most importantly, drops your infection risk from 1 in about 2,500 to less than 1 in 125,000. So going dropless can save you big in terms of complications, improve outcomes, and put a lot of more money in your pocket that you can either use for yourself or to upgrade to a better lens. We'll do anything that we need to do to keep you comfortable for the procedure. Most patients are fine being IV free, so they don't need to get the stick for the IV, but they also just put 2 things under their tongue and they're happy during the surgery. They generally they're awake, but they don't care. And we want you to be awake, but just not anxious so that you don't move around during the procedure. But again, there are many different ways to make somebody comfortable, and we generally are able to work around any level of anxiety. There are different kind of lens implants. When you do cataract surgery, you need to replace that cloudy lens with a man-made lens, or you'll have George Burns or Harry Truman glasses. With a regular lens, for most people who don't have a lot of astigmatism, your vision can be very good without glasses, but you'll absolutely, positively need glasses for reading up close or at that intermediate distance for the computer. Although everyone says, I love my vision after the surgery, 2 years later with a regular lens, they'll say, I love my vision, but I hate these darn reading glasses, what can I do? And my options are fairly limited at that point. So it's better to make the right decision about lens during the initial consult before you do the surgery than to change your mind later. So for astigmatism, for about 70% of us who have enough astigmatism that it will affect the distance vision, using an astigmatism correcting lens is the best way by far to treat that. It's more accurate, more durable, more predictable than laser, than manual limbal relaxing incisions, and they're relatively inexpensive. At the Eye Clinic of Florida, it's just $7.95 to upgrade to one of these type lenses per eye. And generally with them, the distance is amazing with it and stays that way. Some of them even seem to give you some intermediate vision, although that's not what their FDA indication is for. The next kind of lens is the one that allows you to see distance and up close. There are 2 main classes of lenses that can do this. There are 3 main classes, but we'll cover 2 of them in this video. The first kind is called a multifocal lens, and these lenses split light. They're great at distance, they're great at intermediate, and I'm really only considering the panoptic lens here. It has a very good near vision, but about 6% of patients can have issues at night. Incidentally, the 6% that described it in the US trial as being severe halos and glare at night would not have replaced the lens. They appreciate their reading more than the nighttime issue. But for people who have any other eye problem other than cataract, glaucoma, a little bit of macular degeneration, diabetes, or if you're just worried about the future, Crystal Lens is my go-to option. Crystal Lens has an astigmatism correction in it for free. It allows the distance and intermediate to be very, very good. You can see about 20/40 up close, not 20/20, but it doesn't have nighttime issues, so it has no negative to it. So there's distance, intermediate, and near, and then there are problems at night. You need to decide which of those things are most important to you. They're the same price here at the Eye Clinic of Florida. And we've done over 2,000 of these type lenses over the last decade. They're incredible. About 45% of our patients pick them, and that's generally why you see our reviews are so good online. If you have any other questions, please feel free to contact us during the consultation. And this is really about the Eye Clinic of Florida's process. I'm not sure really this applies to any other physician or their process. If you'd like to learn more, check out our website, www.seebetterflorida.com, or call us at 813-779-3338 and make an appointment.